Today, all over the country, people are stopping to remember the life and works of Martin Luther King Jr. And I think it's just a tremendous tribute that all over the country people are doing that. In fact, in some places all over the world. But we have a tremendous responsibility to continue the dream. And I want to talk about that from the standpoint of health. What does Martin Luther King Jr.'s dream have to do with health in the first place, you might ask? And I want to say it has a lot to do with it. You've heard a lot of quotes from Martin Luther King Jr., and I have, some favorites. I sometimes think that one of my favorites, of course, is when he said the ultimate measure of a man is not where he stands at times of comfort and convenience, but in times of challenge and controversy, where do you stand? That was one of his favorite quotes. And of course, the I Have a Dream speech, in which he made it very clear, and you're making it clear this morning, that this was a dream deeply rooted in the American dream. Martin Luther King's quote about health is not one that you hear a lot. And for some of you, today may be the first time that you've heard what he said about health. Martin Luther King Jr. said that of all of the injustices known to man, perhaps inequality in health care is the most shocking and the most inhumane. What is this about? What is this whole thing of disparities in health about? Is it a political issue? Is it a social justice? No. It is a matter of life and death. And why do I say that? In the spring of 2005, we had an article in the Journal of Health Affairs, we at the Morehouse School of Medicine, and we asked the question, and you may have heard this question applied to some other things, but we asked the question, what if we were equal in terms of health outcomes? What if we were equal in terms of health outcomes in this country? And we looked at mortality rates and ratios going back to 1960. And of course, the only two groups in the country where we have that kind of data are African Americans and whites. We know, for example, that in 1900, not long after slavery, we know that the life expectancy in America was 47. And we also know that in 1900, the life expectancy for whites in America was 49. And for African Americans, it was 34. The great disparities coming out of slavery in terms of life expectancy were really shocking. We made a lot of progress since then in terms of life expectancy. Today, about 5 or 6 years separate the life expectancy of African Americans and whites in this country. We don't have that kind of data on any other group. I wish we did. We don't have it on American Indians because we've dealt with their health in a different way, in a different system. We don't have it on Hispanic because they are new to the data systems. So the only two groups where we have that kind of data are African Americans and whites. When we asked the question, what if we were equal, and we looked at the data, we came up with something called excess deaths. Deaths that are more than you would expect for a group. And we actually calculated excess death by looking at what the death rate would be for African Americans if they were the same as for whites in this country. And don't get me wrong, whites in this country don't have the best health data. Our health could be much better, especially given the wealth of our country. We trail countries like Sweden and Norway, even England and Canada. But I mean, even if you just take what is in this country and say, what if African Americans in America had the same mortality rates as whites? And this is what we came up with. In the year 2000, if we had the same mortality rates as whites, there would have been 83,500 fewer deaths among African Americans in the year 2000.